Have you ever really stopped to think about how our bodies get built? It's like there's this incredibly complex, invisible blueprint guiding everything. But what happens when that blueprint has a few surprises written into it? Well, sometimes the evidence is hiding in plain sight, in a place you really might not expect.
Okay, so take a look at this. At first glance, it just looks like a normal smile, right? But look a little closer. Yep, right there, kind of nestled between the two upper front teeth, is a tiny extra tooth. It's a completely unexpected addition, a really fascinating detour from the standard plans.
And this brings up a pretty cool question. Why does our body's internal construction crew sometimes go off script? What causes these little deviations from the standard model? Let's dive in and find out.
So what do scientists even call these little surprises? Well, the official term is a developmental anomaly. Now, I know that sounds super complex, but the core idea behind it is actually surprisingly simple.
A developmental anomaly is really just a fancy way of saying a malformation that happens because of some kind of disturbance while the body's growing. Think of it like a tiny glitch or maybe a little smudge on that original blueprint, which leads to a slightly different outcome in the final construction.
So that leads to the next question, right? What causes these glitches in the first place? Well, the reasons fall into a few key categories, and you can almost think of it like a nature versus nurture debate that's happening at a cellular level.
First up, you've got hereditary causes. This is where the instructions in the genetic blueprint itself are passed down with a change already in them. Then there are acquired causes, where the blueprint is perfectly fine, but something in the environment, the construction site, so to speak, disrupts the building process. And then, sometimes, it's idiopathic, which is basically the scientific way of saying it's a complete mystery. We honestly don't know the exact cause. Okay, let's get a little more specific. One type of anomaly is called a hamartoma. Now, this isn't cancer or anything like that. It's just the body's building process getting a little overenthusiastic. It creates this excessive, disorganized bundle of normal tissue right where that tissue is supposed to be. It's kind of like having way too many bricks delivered to just one corner of the construction site. And a perfect example of this in the world of teeth is something called an odontoma. It's a hamartoma that's made of dental tissue, basically a jumbled, disorganized mass of enamel and dentin that just, well, it didn't form into a proper tooth.
All right, so now that we've got the basics down, let's explore some of the most common ways these anomalies show up in our teeth. And we're going to start with size. What happens when the blueprint gets the scale all wrong?
Well, this can go in two totally opposite directions. You have microdontia, which results in teeth that are unusually small, and then you have macrodontia, which causes them to be unusually large. So diving into microdontia, we find that it's actually more common in females. It can affect just one or two teeth. A classic example is the peg lateral, which is a small, kind of cone-shaped incisor. Or, in much rarer cases, it can be generalized, affecting all the teeth, which is sometimes seen in conditions like pituitary dwarfism. And on the complete flip side, you've got macrodontia, which is more common in males. And just like its smaller counterpart, it can be localized to a single tooth or generalized across the entire mouth. And when all the teeth are abnormally large, it can sometimes be linked with pituitary gigantism.
So what happens when the blueprint doesn't just get the scale wrong, but it completely miscounts? This brings us to anomalies of number. In other words, too few or way too many teeth.
And the extremes here are pretty striking. On one end of the spectrum, you have anodontia, which is the congenital absence of teeth. And on the other end is the condition we saw at the very beginning, supernumerary teeth, which just means extra ones.
So anodontia is the congenital, meaning from birth, absence of teeth. Now, total anodontia, where no teeth develop at all, is extremely rare. What's way more common is partial anodontia, where just one or a few teeth are missing. I mean, have you ever heard someone say they were born without wisdom teeth? That's it. That's a form of partial anodontia. And of course, scientists have this fascinating way of breaking it all down. Now, don't worry, you do not need to memorize this chart, but the really important thing to see here is the distinction between true anodontia, where a tooth just never even started to develop, and false anodontia, where a tooth did form, but it's either still stuck in the jaw or was lost later on.
And now we're back to the opposite problem, supernumerary teeth. This is what happens when the body just decides to form an extra tooth bud during development, leading to more than the usual number. And yep, the most common kind of extra tooth is that little guy we met right at the beginning, the mesiodens, popping up right at the midline.
So this is all a really fascinating biological curiosity, right? Well, yeah, it is, but it's also more than that. Understanding these anomalies has some serious real-world importance. So, why does all of this matter?
Well, these conditions aren't just oddities, they have real clinical significance. Extra teeth can cause major crowding and alignment problems. Missing or misshapen teeth can affect appearance and how you chew. And in some cases, an impacted extra tooth can even lead to a cyst forming deep inside the jawbone.
And this brings us to an even bigger idea. You know the word syndrome? It actually comes from the Greek for run together, and it describes a collection of signs and symptoms that consistently appear together, all pointing to a single underlying condition.
So here's the crucial point. While a single little peg lateral might just be an isolated quirk of development, sometimes having multiple extra teeth or certain patterns of missing teeth can be a clue. It can be a single piece of a much, much larger puzzle. They can be one of those signs that run together as part of a broader genetic syndrome. When you think about it, our teeth are so much more than just tools for eating. They are a living record of our development. Each one tells a story about this incredible, intricate dance between our genes and our environment. It really makes you wonder, what story does your own blueprint tell?